Next up, Maia Ottenstein, Digital Experience Design Lead at Thomas Jefferson University Hospital.
Hi, everyone. Like she said, my name is Maia Ottenstein. I am the lead digital experience designer for user experience research at Thomas Jefferson University Hospital on the Digital Innovation and Consumer Experience Group. And I want to tell you a little bit about my group before I start to give you some context, because it's very, very cool. My group functions as a design firm within the hospital system, within Thomas Jefferson University's hospital system. We create innovative healthcare solutions for everyone from healthcare providers and staff to the patients, caretakers, and family members that utilize our system. Our solutions include everything from using emerging technologies to improve healthcare training for professionals to improving patient experience utilizing the campus shuttle that helps people get around our hospital campus. But for the most part, we like to focus on the patient experience. And that's because when someone's in the hospital, they're usually having one of the worst days of their life. They are in a vulnerable state in an unfamiliar environment. And this is frequently accompanied by feelings of fear, frustration, confusion, especially if the patient is very badly injured or sick, elderly, young, or disabled. And while care teams are always, of course, trying their hardest, patients still can feel very, very alone. And we're addressing this problem by creating human-centered solutions to address the patient experience at every touch point with our hospital. Some examples of this are the Sidney Kimmel Cancer Center, for which my team has created what they call the 360 patient care experience, which is a very holistic experience that has a robust online resources for our cancer patients, as well as a welcome center with in-person support, as well as digital interactive kiosks. And all of this is just to supplement the actual care center itself. We also actually have an Alexa skill that helps people find the appropriate doctors. So all of this is great, but we also want to make sure that our inpatient hospital patients have the best possible experience. And that's where our smart patient concierge comes in. The goal of this project is to improve the patient experience through empowerment. And the thinking behind this is that giving people control and access to resources in an accessible, easy-to-use format that they can use from anywhere in their room, they'll feel comfortable and content during their stay. With patients frequently feeling confined to their beds, a simple act like opening the blinds or turning off the lights becomes a challenging endeavor. And giving them this opportunity can make them automatically feel stronger and help them heal. Also, as people have addressed earlier, it's actually just a health concern to not give them this kind of tool, because something like dropping the TV remote, which is frequently also the call bell, can lead to a patient either not being able to call for help, like was mentioned earlier, or falling out of bed. But the coolest thing about this system is that we built it completely ourselves. We are not using Google Home. We are not using Amazon Alexa. I'm going to say, do not come to me with any technical questions. My colleague, Mariam Talevi, is here. She's our development lead, and she can talk to you about how we actually made that happen. But it's very special, because that means that our system is fully HIPAA compliant, which is a huge deal if you've dealt with creating these systems before. And it also means that we're able to provide Jefferson-specific information. So our patients are able to access logistical information about our hospitals no matter where they are in the system. It also means that all the information that they're getting is coming directly from Jefferson resources, which means that the information that they're getting is consistent and reliable. It's information that we trust. Because we're going to create skills not only for the patient, but also for the provider side, it means that we'll also be tackling a wider range of skills than a lot of existing solutions. So right now, we currently have rigorously QA tested and ensured the HIPAA compliance of our existing tools, which, as you see, are kind of basic, fundamental voice skills with the addition of the logistical questions about the hospital. But we are also going to be integrating into hospital systems and EMRs in the future. So where we are right now, just to wrap up, we are currently pilot testing this solution in Methodist Hospital, which is a hospital in our system. We have a floor of the hospital with our pilots on it. We are also pursuing accessibility testing at a local rehabilitation hospital, because it is my personal goal to ensure that we have the most accessible voice assistant on the market in the future. And our next phase will be adding environmental controls and fully integrating with the hospital system. Thank you.